we are back with Cone Health gastroenterologist Dr. Gabriel Manzarati talking about colon cancer. Let's talk a little bit about that prep for the colonoscopy. It is that dreaded night before prep that people talk about. So let's just get it out in the open. What is it?
Yeah, so most of the preparations that we use are Miralax form pegylated glycol. But there are some tablet-based forms that still require a good amount of liquid to be taken. But many times it is the difficult part for patients. And so what I usually tell patients, if I see them in clinic or that my nurses will in the pre-visits, will be to mix it early in the afternoon, put it in the refrigerator, let it chill for a few hours. It's usually a little bit more palatable when they drink it cold. Once it's time for them to start, if they use a straw, you'll activate a little bit less of your taste buds once it's going down, and you'll actually drink it a little bit faster. If patients deal with nausea regularly or start developing nausea during the drinking of the preparation, slow down, stop, it's okay. Give yourself 5, 10, 15 minutes and then go back, because you don't want to retch that up, during the drinking part, because otherwise you may have to restart and everything like that. So doing some of those things can be quite helpful for the preparation.
And you can mix it with like some kinds of like Gatorade or lemonade or whatever?
If we end up using like a Miralax-based preparation, which we do sometimes, we'll be able to let patients go ahead and use Powerade, Gatorade, or of their choice, as long as it's not red or purple. But that can sometimes help for patients if they've had either their prior colonoscopies that they didn't tolerate the prep. Maybe a Miralax-based prep will be helpful.
Gotcha. Okay. So people who've never done this before, let's explain just how quickly it should work. So you're supposed to drink all this stuff the night before. Is it something where you need to clear your calendar and be home as you start drinking it?
Yeah, so we do split-based dosing, so half of the preparation will be taken the night before, half the morning of the procedure. We usually begin around 5 or 6 for most individuals. So most of the time, within 1 to 3 hours, you're starting to move your bowels. And so it is important to kind of have that evening off, because you will need to be near a restroom.
Okay, and let's also talk about the procedure itself. We talked about the leading up and how you were going to talk to them and stuff like that, but it's about, what, 20 minutes?
Yes, so usually about 20 to 30 minutes for us to do the entirety of the procedure. The cleaner your preparation, the easier it is for us to do our job, so that we can decrease the risks of the procedure and help minimize missing lesions as well. And it just depending on what we end up finding, if we find multiple polyps, that may extend the amount of time that the procedure lasts. But the recovery is about 30 to 40 minutes.
Okay, and then you get to go home.
You get to go
home. And then
home.
you get to eat.
Yes, we usually tell patients a lighter meal initially, just because they've had anesthesia.
Right.
Someone will need to take them home because they will have received anesthesia for the procedure, but just take it easy the rest of the day, and then by the next day you're back to your normal activities.
Okay, we've got about a minute or so. What would you tell people who are kind of putting off the colonoscopy because they're nervous about it?
Yeah, I think that prevention is the key to colon cancer. The earlier that we have an opportunity to find a lesion, if it's present, the more chance that we may be able to have it removed endoscopically. And so if we are concerned at any time of having not necessarily wanting to do a colonoscopy because of the risks, obviously we are happy to meet those patients in clinic, but any screening is better than no screening, and at LeBauer GI we'll be very happy to work with you on your health journey.
Real quick, what are some colon healthy diet items?
Yeah, certainly. So patients who eat high fiber diets, between 20 to 30 grams of high fiber, can be quite helpful. It's actually protective against colon cancer. Eating between 4 and 6 amounts of fruits or vegetables per day can be helpful, and minimizing the amount of red meat per week to less than 5 portions a week has been shown to have less risk for the development of colon cancer.
Okay, great. These are all good things that